So you're at the doctor's office for whatever reason, and you think to yourself, hey, here's my chance to ask that one question that's been on my mind, and then for whatever reason, you don't. Maybe it just slipped your mind when you came face to face with the doctor, or you really didn't have the oomph to bring it up.
Then Ask the Doc is for you. And the doc is in the house. PRMC's Chief Quality Officer and Hospitalist, Dr. Chris Snyder. Welcome.
Thanks.
Yeah.
Good to be back.
Glad to have you here. Can I ask something here? We've got a bunch of anonymous questions to ask you that we know you have the answers for. Can I ask you real quick about something else?
Sure.
Most recently, when I've checked into the doctors, they've been asking for my social security number.
Mm-hmm.
Do I really need to give them that? Because I know all these hackers are now attacking the healthcare places.
Yeah, we've always had a threat. At the hospital, we ask for it typically at a registration process. And
right.
Same thing in the office. A lot of it has to do with the payer. The insurance companies need it. So we can actually track your healthcare dollars. So there's a lot of connection between payment and healthcare, obviously. And we moved to a new system where we actually just use name and date of birth pretty much is all I need to get your information. But on the finance side, there's a whole different world of
right.
The IRS and all those other things that track our healthcare. They track your bills,
gotcha.
All those wonderful things. So we've buried at the hospital the Social Security number, so it's not utilized by the frontline staff. That way, it's less visible to everybody. We utilize certain medical record numbers based on what we're looking to get.
Right.
So for healthcare information.
And it's all protected as
it
far
is,
as
absolutely.
online.
Yeah, it's all HIPAA and compliant with that. So and then we track and audit and make sure you're supposed to be in there too. So.
Thank you. Thank you.
All right.
That was
Absolutely.
an anonymous one from me.
Sure.
Anonymous from you. Okay, we have a bunch of questions here. The first one, any truth to the claims that cooking or microwaving vegetables removes their nutritional value?
Yeah, the microwave's a rapid cooker, so it's actually good. Anytime you overcook and oversaturate vegetables, you lose those nutrients because it breaks up the proteins and the things that hold the vegetables together. So when they break down, so actually microwaving is probably one of the better ways to cook. You just don't want to overcook and oversaturate anything. Even if you boil, you're boiling away a lot of the nutrients.
Really?
Yeah, so you're better off steaming, utilizing that radiant heat. So no, that's kind of a wives' tale. I've heard that before, and I'm like, nah, microwaving's good. Short and sweet, and again, don't overcook them.
Right.
I was waiting for him to say, nope, eat everything raw.
Oh.
Is there an absolute cutoff age for a safe pregnancy? Can you discuss some of the concerns when it comes to older women having a baby?
Yeah, there's a lot of concerns. Unfortunately, when women get over 35, they run the risk of Down syndrome, diabetes, gestational diabetes, hypertension. So the medical problems start coming out because you're older, sorry. There are a fair amount of women who do have babies over the age of 40, actually over the age of 45, which is kind of scary when you're looking at the risk associated with the medical problems that the mother will have, not only the mother, but then you have the baby to worry about too. Yeah. So 35 is kind of the cutoff age, but there's no real rule about that. Plenty of women have normal deliveries, normal babies. It just, we do a lot more testing and a lot more evaluation and a lot more visits to ensure that you and the baby are safe.
Advanced maternal age, right?
Yeah,
AMA.
it's tough.
All right. I often get aches in my right arm, particularly in the upper arm. It's not a tingle, but it's uncomfortable and goes away after a few minutes. Any idea what this might be?
So the right arm is connected to the neck and the central nervous system. If it's positional and it resolves with positional changes, it's usually musculoskeletal. Something persistent though, believe it or not, a lot of people don't realize their gallbladder refers pain to the right shoulder. So there's stuff under the diaphragm on the right side because of the way the neurologic system works, but a gallbladder could actually show up as right shoulder pain.
Really?
And that presentation's rare, but it is there. If you're a female 40 and fertile and you have right shoulder pain and you come in nauseating and vomiting, you need to have a gallbladder evaluation. So there are some things related to it. Dermatomes are neurologically promoted, so your spinal cord puts out nerves to all parts of your body. So this distribution here is the neck, so C5 in that area, cervical spine 5. The nerves that come out of the shoulder go into that part of the shoulder, and actually football players get a lot of injuries here and they can have chronic issues there also in their dermatome. So it could be neurologic, could be a number of things, but again, get it evaluated if it's persistent. But like I said, if it goes away after moving around, it's probably nothing. It's probably more musculoskeletal or arthritic.
Interesting.
It's amazing.
Yeah.
Absolutely amazing. Okay. Sometimes when I'm in bed, I can feel my thigh twitching. It feels like it's the muscles. Is this normal?
It's normal. Restless legs, some people call it, so it can be pretty miserable. Some in the elderly, it gets very uncomfortable. It can actually be cramping and painful. It can be an early sign of vascular problems too in the elderly, so you do have to consider those things if they have abnormal pulses. But in the more common folks, it's nothing usually, as long as it's resolved. It's annoying. The twitching could be an electrolyte abnormality, so microwave those veggies shorter times and get more. Just throwing it out there. So might as well add on.
Circling back.
Absolutely, we're not going to touch that. But vitamins and you know, getting plenty of nutrients, definitely fruits and veggies help that kind of thing. So it helps that muscle relax.
Yeah. All right. This one's kind of interesting. I recently went to the doctor, and the phlebotomist had a hard time finding a plump vein. As a result, my arm is now black and blue. Do I have a right to be upset, or am I overreacting?
Yeah, no, it's nothing to get upset about. Unfortunately, you're puncturing a non-puncturable object with a needle. So you're putting a needle through a piece of pipe, basically. It's a very soft pipe, it's a vein. And they do break. They break. The older you get, the worse the collagen is, so the more they break. So you see, unfortunately, grandma comes in and she's got bruises after coming to see me. So it is what it is, and they do bleed. Your body has a wonderful little Band-Aid it can apply to it. It's called Mother Nature's Band-Aid, which is made up of platelets and cells that stop you from bleeding, causes a scab too, in other words. But unfortunately, as you get older, those things don't work quite as well. So, but it's not uncommon to see that. It's not on purpose. And again, you're sticking a sharp object into a balloon, you're going to have some leakage sometimes.
So be kind to your phlebotomist.
Yeah, they are. It's a hard job.
That is a hard job.
And unfortunately, I order it, and they get
come
stuck
back
with
to
it
you.
literally.
PRMC's Dr. Chris Snyder, thank you so much.
Thank you.
Learned a
Good seeing
lot
you.
today.